Have you ever lain awake at night, your heart racing, wondering if it's trying to send you a terrifying message? Ever felt like your heart is playing hide and seek with your health, leaving you in the dark? Today, we dive into the mysteries of the heart as we reveal 6 silent heart attack signs you shouldn't ignore. We're going to talk about these subtle and sneaky signs we often ignore, such as excessive sweating and what it means, overexhaustion and its connection to heart attacks, and more. I will also reveal 3 things you can start doing now to lower your risk of having a heart attack. So stick around till the end to find out what they are.
This is Metamorphic Fix.
You're curious as to what a silent heart attack is, right? The majority of heart attack scenes in movies involve the victim clutching their chest tightly, gasping for air, or losing consciousness. It's not always as dramatic, though. Contrary to what you might have seen in Hollywood, a silent heart attack has none to very few symptoms. They refer to it as silent myocardial ischemia. It is extremely difficult to comprehend how something as significant as a heart attack could occur without your knowledge. According to research, 45% of heart attacks are silent. Women have a much higher chance of being struck by one than men. Because the symptoms of a silent heart attack are so mild, they are frequently mistaken for those of other, less severe conditions. But what is the real culprit of silent heart attacks? Blood that is rich in oxygen powers your heart. Your coronary arteries start to fill with cholesterol-rich plaque. Blood clots can form at the plaque site when platelets from your blood start adhering there, which could reduce blood flow. Oxygen levels that are low or absent prevent your heart muscles from working at their best. They become less able to pump blood. As a result, a silent heart attack occurs. The consequences get worse the longer your heart isn't getting oxygen-rich blood. Atherosclerosis is the primary factor, just like in any other heart attack. In most cases, you can determine what caused a fatal heart attack. Either your cigarette usage, salt-loaded fast food, or stress will be the cause. According to studies, having type 2 diabetes significantly raises your risk of having a silent heart attack. However, this isn't always the case. Some circumstances that may lead to a silent heart attack are occasionally beyond your control. The situation can become complicated if there is a family history of heart disease, preeclampsia during pregnancy, or COVID-19. Additionally, your risk of having a heart attack increases if you are a postmenopausal woman over 55 or a man over 45. Are you interested in hearing some surprising statistics? In the United States, a heart attack occurs once every 40 seconds. Your heart, however, is far more intelligent than you may realize. It will alert your body before completely shutting down. You might be able to avert a catastrophe if you keep a close eye on a few unusual symptoms. After a heart attack, you don't have to wait for the cardiac treatment to start. Cardiovascular preventive care may be able to keep you from developing one. However, how do you recognize a silent heart attack? The American Heart Association asks that you watch out for the following warning signs. Number 1, suffering from an ongoing flu. Inhaling hot steam and drinking herbal teas at home might not be sufficient. Every one of us experiences illness occasionally. It might result from prolonged exposure to the cold or from catching it from someone. Suffering from an ongoing flu can be linked to silent heart attacks due to the added strain it puts on the cardiovascular system. The flu's inflammation and increased heart rate can stress the heart, potentially triggering a silent heart attack, particularly in individuals with underlying heart issues. Number 2, prolonged stomach aches. Prolonged stomach aches can be linked to silent heart attacks through referred pain. When a silent heart attack occurs, the brain may interpret the heart's pain signals as originating from the stomach or abdomen due to shared nerve pathways. This can lead to individuals experiencing stomach discomfort, instead of recognizing it as a potential cardiac symptom. Those at risk of heart disease must be aware of this phenomenon and seek prompt medical attention if there is any suspicion of a heart issue.
If you're enjoying this video so far, please support us by hitting the subscribe button and liking the video. By doing this, you are helping us reach more people to share this amazing information with. If you have a topic that you want us to talk about, let us know in the comments. We are looking forward to sharing more amazing content with you in the future. Now that that's out of the way, let's get back to the video.
Number 3, excessive sweating. A great way to remove toxins from your body is to sweat. Your body reacts in this way naturally to physical stress or extremely hot and humid weather. However, if you are perspiring profusely despite having the thermostat lowered, you must take immediate action. Number 4. Heartburn. Eating spicy sausages or meatballs with sriracha sauce for dinner may give you a burning feeling in your stomach. Your chest starts to hurt because of how much it hurts. The telltale signs of a heart attack are chest pains. Neuropathy is the most typical complication of advanced stages of diabetes. Your nerves are therefore no longer sensitive to stimuli. After touching something boiling hot or getting pricked with a needle, you might not feel anything. The same holds true for heart attacks. A diabetic may not experience a heart attack as severely. The nerve damage will effectively silence it. Your heart may feel full, squeezed, and pressured like another digestive problem. In a 10-year study, 8% of diabetic participants experienced a silent heart attack without being aware of it. It really is dangerous. Number 5. Body aches. You may have heard that a heart attack only causes pain to radiate to the left arm. However, this isn't always the case. Sometimes, in addition to the back and abdomen, the pain may also radiate to the right hand, jaw, teeth, and center of the chest. The backache you experience after spending too much time at your desk is not the same as this one. It is known as angina pectoris. These symptoms may seem very subtle, but trust me, your body will let you know when something is off. Chest pain may or may not be present along with these unusual symptoms. Number 6. Overly exhausted. Never disregard feeling tired as unimportant. Although it might indicate something less grave, the possibility of a silent heart attack cannot be discounted. This tiredness is not the same as staying late at the office or logging an extra mile on the treadmill. It occasionally has a connection to dizziness and trouble breathing. Don't sit on it if you experience any of these. The hospital is the best place to go. To figure out what's going on, your doctor will perform a few tests. When examining a heart attack, an electrocardiogram, CT scan, and MRI are typically the best options. Blood tests can detect messengers your heart sends to the bloodstream before and after a silent heart attack. They're known as cardiac biomarkers. Diagnostic aids include coronary angiograms and stress tests. Additionally, a group of heart specialists will be called in if the cardiac arrest is actually occurring. They may prescribe blood thinners like aspirin or nitroglycerin to ensure your heart receives enough blood, depending on the severity. They will continue to track your progress as the blood clots dissolve and your ability to carry oxygen increases. If the blood vessels have narrowed too much, it may be necessary to plan an invasive procedure like stenting, ballooning, or bypass surgery. Remember, you should not simply write off silent heart attacks as unimportant. Although you might think you have vanquished the deadliest killer, there are dangerous side effects. Having a silent heart attack increases your likelihood of having another one by 35%, in case you didn't know. Every person's heart attack lasts a different amount of time. It typically lasts between 15 and 30 minutes. Anything beyond that results in permanent modifications. Some people may experience cardiac arrhythmia, a condition where the heart loses its regular rhythm. You are also more likely to have a stroke later in life as a result of other long-term effects. Now, let's talk about the 3 things you can do to lower your risk of a silent heart attack and make a healthy change. Tip 1. Start working out. Start by going around the block. Begin speed walking slowly. You'll feel motivated to jog in a few days. Try yoga or meditation classes. They will improve the condition of your heart. You can combine it with dance or aerobics. Last but not least, remember to include some resistance training. Tip 2. Eat more high-fiber, nutrient-dense foods. Vegetable fiber can help keep your heart healthy. Don't forget to regularly consume foods high in omega-3s such as salmon, avocados, and walnuts. Keep unnecessary snacking and sweets to a minimum. When you are craving something sweet, eat a piece of fruit. You can better control your blood sugar with its assistance. You can prevent atherosclerotic plaque from forming blockages by controlling your weight, blood pressure, cholesterol, and blood glucose levels. Tip 3. Eat more high-fiber, nutrient-dense foods. Also, give up smoking. According to studies, smoking causes the arteries to narrow and reduces the amount of oxygenated blood that reaches the body's vital organs. Our goal is to circulate the most oxygen-rich blood possible through your body, and smoking won't obviously help.
For weekly freebies and contest giveaways, make sure you follow the link in the description to Metamorphic Health Weekly, where we send out a wide range of health tips, free recipes, fitness tips, and contest giveaways. Be sure not to miss out. Click the link below for Metamorphic Health Weekly. We hope you enjoyed today's video and would gladly appreciate it if you gave us a like and hit that subscribe button to help support the channel.